Joining me live from New Haven, Connecticut is Dr. Chen. He's an assistant professor of public health at Yale University. Professor, I want to ask you about this new cluster of cases in Beijing originating from that fresh food market. What are we learning about the way COVID has spread from this cluster?
Glad to be with you, Elaine. So Beijing recently found some cluster of cases, but it's mostly concentrated toward the fresh food market. And there are some sporadic cases in other cities associated with this market. But overall, this is still, I believe, is in an early stage of transmission because all the cases, when we trace back, is associated directly or indirectly with this market. But some urgent steps need to be done very soon. For example, the testing. Ramping up the test will give us the real-time data to make a best policy. And also, if we only test the people and isolate them, may not be enough because there's an incubation time period. So we need to know that who were in close contact with those infected. So the contact tracing will be important. So I think China has been using the big data like the transportation migration data based on the cell phone devices to track people and to contact them to self-isolate them. So I think that's a step to get the overall picture and make sure the spread is limited in a very small scale.
So are you surprised at all that Beijing raised its emergency response level? And do you think this is considered a second wave, or is this just a flare-up?
I think this is just a sporadic infection and a cluster of transmission cases because the virus has not been fully mitigated and it could happen in anywhere. But what's most important is to keep track of that using the device, using the big data analysis. I think we can look at China's labor, like South Korea has been also having some cases day by day, but they are able to make sure the testing is still being implemented and the contact tracing are effective. So they are able to still keep the economy open. So I think at this stage, there's no need for the general public to be panicked.
I want to get your take now on the China-Africa Summit about cooperation and coordination among everyone. Seemed to be a major priority. What really stood out to you, and what can all sides get out of this when it comes to methods, sharing methods, and supplies?
Yeah, I noticed that there are some large measures like relieving the debt of African nations and sharing the experience about coping with this pandemic. But I would say that this is not a new bottleneck of African countries being created due to this virus outbreak. But it is a manifestation or is a reflection about already being at the bottleneck in the system. So I think the international community have large room to collaborate together to find a systematic solution to fight this. Because Africa has a large poverty and worsening inequality issue, which may contribute to the difficulty with practicing social distancing. And as mentioned in the documentary, and there's a fragile healthcare system which crowd out identification of the treatment and identification about COVID-19 patients in severe conditions. And I also noticed there are large shortage of medical workers. And since China has been going through this process, has much more clinical experience to deal with this virus outbreak. And overall, China during the past few decades has been going through the transmission about disease portfolio from acute disease, more infectious disease, to now non-communicable disease. So China has a lot of lessons and experience to share with the African continent. I think the African countries are dealing with not only the COVID-19 pandemic so far, they are also dealing with HIV/AIDS, tuberculosis, and malaria. So all those are big challenges to those very fragile systems. But the international community has a lot to share, not only for China, but I think the Gates Foundation and other international organizations has been sharing and building the surveillance system and the testing and the contact tracing.